I'm really excited about today's meeting because we have a lot to cover and we have a lot of guests. I also, too, want to be able to thank our subcommittee members, our task force members that are working really diligently to make this happen, and all the behind the folks, people that are at NSC that made all this happen today. So it's great. So let's get started. And welcome to anyone new that has joined us. Okay, well, today we have a full agenda. Today we're going to go through the national subcommittees and go over the projects that they're working on. I'll be presenting on the state task force development and support. I'm the active chair. And if anyone would like to chair this subcommittee, please reach out. Communications is Maureen Johnson. And for legislation and policy, we have Lori Walker. And then for the states, I'm really excited to welcome Patti Liedy from Florida. Virginia is Dr. Becca Reid. We had our first meeting this morning. It was great. And Lisa Kons from Minnesota. So let's get started with looking at the State Task Force Development Support Committee. And what we are doing is we are targeting a specific task that we want to be able to accomplish, making it small bites that we can accomplish together. We are this resource is the project of the state committee, and to provide a targeted, credible hub for advocates, caregivers, and consumers seeking to better understand the technologies and research shaping prevention efforts. So these are the categories that we looked at when we last met: technology research, best practice, and advocates. And the members decided that we really want to focus on the technology and research to be able to get those valuable tools out. So what they're going to do is they're going to prioritize on looking at the OEM, which are built into the vehicles, aftermarket devices, mobile apps, and Bluetooth. So what this is going to be, it's going to be a library content with videos and research. So we have the video content. We decided 1 to 10 minutes. We want to give them short bites of information. We're going to reach out to experts in the field. We want to be able to demo the vehicle and car seat technology, get testimonials and real world stories, and get some bystander how-tos. For the research library, these are going to be peer-reviewed studies and tech reports, data trends, and best practice guidelines. So this will be available for caregivers, our advocates, also to our state task force members. They could be able to provide these at their meetings to be able to educate their members. So next steps are going to be, we need to identify who the contributors are going to be. We're going to make a list of all the technology and research we want to be able to gather in the first round. We have video submission guidelines, which you'll see off to the right, so things come in that are uniformed. And we want to be able to host webinars to introduce the library and promote through the national work group, state task forces, and state and national partners. So our next meeting, if you would like to be able to join us, it's on June 5th from 11 a.m. to noon, and all are welcome. So I want to move on to the communication subcommittee, and Maureen.
Thanks, Alexis. So after a number of meetings and discussions, we decided that our project would be an employer communication packet. And through the auspices of the National Safety Council, as well as input from members of our subcommittee, we've put together an awareness packet, I'll use this word toolkit, if you will, that includes parking lot signs, infographics and posters, a window cling, and that's for like the doors to places of business, not for individual cars. We want to promote the free 10-minute e-learning course on prevention. We want to provide an easy way for group enrollment in the e-learning course, so that will be included in the instructions. And then a sample employee email template, which employers can use to encourage their employees to participate in the training. On this slide, you're going to see some of those materials. We've got the hot cars are dangerous posters, one with a palm tree, but we also discuss the fact that places like where I live in Vermont don't have palm trees, and we didn't want this to be, viewed as, oh, this is someplace where it gets hot. This isn't for places like Minnesota or Washington State or Karma. Are you in South Dakota? Or places like Vermont. So
North Dakota. North Dakota.
North Dakota.
North
Okay.
Dakota. Yep, no palm trees here, I promise.
So, these are materials that we plan to distribute through state and nationwide partners and organizations. You can move on to the next slide, Alexis. So the last meeting that we had, we kind of brainstormed some of those organizations that would be the conduit to getting the packet into employers' hands in their catchment area. So consumer groups, Safe Kids coalitions, the other entities that are mentioned on here, chapters within the National Safety Council, which I think personally is a really great avenue, because generally the National Safety Council members and chapters are employer focused. They're occupational safety and health focused. So, they have businesses that have employees, and of course they're interested in keeping their employees safe. But this is a great way to communicate with employees about, the risks of PVH and ways that they can protect their families and their coworkers' families. And what's the next slide, Alexis? Oh, so our next meeting, time is just flying by, is May 13th, 3 to 4 p.m. Eastern time. And just as Alexis said with her section, anyone who's participating in this meeting today who would like to join the communications subcommittee, reach out to me and Alexis. We'll be sure to get you on the meeting invitation and the mailing list. And I think that's the last formal slide, but I did want to take a moment to make a bit of an announcement. One of our subcommittee members, and I think one of the more active members, Uwe Meisner, experienced a horrible loss of his home in a fire. He and his family have been displaced. And Alexis is going to put in the chat a link to a GoFundMe site that's been set up. So, and particularly if those of you who have worked with Uwe closely would like to contribute, I'm sure that he and his family would appreciate it greatly. Alexis, did I miss something from our planning?
No, it's great. And that will be on the cpsboard.org website for the national resources, and that kit will be available for folks, and we'll be able to co-brand it too with employers' logos or your logo when it gets out. Karma, is there anything you want to add with sitting on the committee?
No, I think it was well covered. I think the biggest thing was just that trying to make the resources so that they did not feel that they were specific to one region, and people would buy into it and feel like it was easy and ready-made and easy to implement and print off and use.
Great.
And I think we've done that.
And the other thing I should mention is, the cover letter, the letter that an employer can use to send to employees, it's been tailored to these audiences, but with very minimal adjustments, it can be expandable. So, perhaps our next target audience is retailers. And so, there may be something different that we emphasize, because yes, retailers have employees and they have parking lots, but the public is coming in there. So it's not something where we're going to have to reinvent the wheel. It's just going to require some tweaking, some adjustments and modifications based on the target audience.
Great. Thank you, Maureen. Thank you, Karma. There are 3 customizable emails in there. One for you as advocates who would like to be able to reach out to your people in the field to be able to let them know that this is available. And then there is an email that would come from that individual to an employer. And then we have an employer to an employee. So there's 3 emails that are available. All right. Moving on. Lori is chairing the Legislation and Policy Subcommittee. Lori? Lori, are you on?
There. Am I on now?
Oh, there you are.
Okay, good. I'm never silent. You all know that. Anyway, it is a real pleasure to be on with all of you at this time. And the Legislation and Policy Subcommittee is looking at making a pivot from the federal focus to state and local. And I think it's pretty understandable that, you know, the atmosphere and the environment for adding regulations and adding laws right now is under question, and there are many they're under review, and they could be modified or deleted, those that are already on the books. So we thought that instead of trying to mix that message with federal, where the Kids in Cars group is doing a great job of pursuing the federal focus, and we'll stay on that. We're going to take a little pivot from that and look more to the state and the local, exploring the value of local ordinances, sharing the best practice guidelines that have come from some of the requirements and the legislation. And we're going to try and get members of our committee and subcommittee rather, and those of you who have not joined that subcommittee, participate in looking at some of the community locations that you have and learning from other states. What have other states done that maybe requires no additional regulation or law, but is just the promotion of good best practice? And I think one of the things that's going to be the most interesting, the most difficult possibly, is recognizing that there may be limited or absolutely no funding to make these opportunities available at the local level. So it's going to require a lot of creativity on the part of the subcommittee members, getting some of the information, extracting the near miss information, talking with local police and other enforcers in the state as to what they are doing, what they're finding in terms of misuses. And we're going to just have to figure out ways to do this on an extremely limited or no funding basis. Next slide, please. So within the next year, what we would like to do is develop a voluntary survey to determine what's best at the local level to getting PVH practices into the hands of the licensed corporate, private, and home childcare businesses. We thought we would, because we're having such a narrow focus and it would be childcare, we're even going to narrow it more to look at licensed facilities and see if there's a way we can make inroads with them. They have obligations to their state and to their communities, and maybe we can assist them with some of the materials we have. Looking at some of the best practice tools, some of those are developed by our communications subcommittee that you just saw, some of the really great posters or window cling, those type of ideas to make the messaging more official to the childcare staff and the families they serve. One of the things that we know most childcare agencies are afraid of is that they can't reach the parents that they need to find out, is a child coming or is a child not coming to childcare, which is voluntary. In school, they have to go, and then there's a a person, a volunteer sometimes, or a staff member at the school who calls families when their children aren't there, because attendance in school is required, but attendance in childcare is not. And if a parent had a bad night and baby was up all night, or the child and the siblings were up, they may choose just to not go to childcare, but they don't tell anyone. So we have to figure out ways to make it easier for those organizations, those companies, to reach out to their families. And then during this time when a lot's going on in Washington with federal legislation, and where we probably will just be focusing on the good, better, best messaging that we have, we want it to complement or coincide with any future state or federal laws. We don't want to come in out of left field and have something that we've developed that people who will be implementing, complementing, or coinciding with state or federal laws. So we want to be working alongside of them, but not exactly with them at this point. So what we're going to ask our group to do is to identify at least some of the facilities within your community that might be willing to open their door to you or to them, and survey their current practices. What are they actually doing? Do they use technology? Are they using software? What are they doing to identify gaps if they have children who are regularly not attending, but parents don't let them know, or other situations? And what are those things that they do to offset that? And then we're going to ask them, people in our committee and subcommittee, if they have a family member who has a child in childcare, or they themselves work in a childcare center, to visit the center and ask those questions in person. And we want those people in the community to become a resource. The subcommittee will then convene to review the survey results, and we'll be working on developing a few survey questions that will make it easy to put that foot in the door and get the best practice recommendations that they seem to think are most useful, and develop a distribution strategy so that we can get it out to more licensed corporate, private, and home child care facilities. And in the process, we want to make sure that we're looking at the survey and making sure that it's asking the right questions. And of course, making use of the other resources that are available to us through the communication subcommittee. So anyway, I think that's the best that we have at this point. We're pivoting at a really tough time to be instituting new measures. And our next meeting will be on May 8th from 1 to 2 p.m. Eastern Time. And we would love to welcome anyone who's on this call, or someone you may know who would be interested in learning more, to attend that next meeting. So thank you for your attention today.
Great. Thank you, Lori, very much. I appreciate that. So we're going to move on to the state task force model. Florida and Texas helped be able to pull this together. When we're talking about assets, we kept things in mind. We avoided fear-based messaging, and we looked at the different messaging that we wanted to convey. So traditional, you'll see, I'll show you the forgotten, gain access intentional, the vehicle temperature, and the take action. Those are the 5 that the members felt that were strong. And then you see state specific. In the state of Florida, they're the Florida Vehicular Heat Stroke Task Force. So they decided to be able to incorporate the vulnerable adult, the pet, and the unhoused. Law enforcement in Florida shared that there is new laws that homeless are not able to sleep in open spaces, and they're worried that they are going to find refuge in parked cars. And we'll be developing those. So the one to the left has a lot of lines through it, but that's because it's in the process of getting tweaked and formatted. But I wanted you to be able to see it. So you see on the left, that's the forgotten, to talk about the change in routine, distraction, or exhaustion can change your life forever. The font on there and the colors are going to be different when it rolls out. You'll see that on each one of these, we have co-branding. So on the bottom, you see the Florida Task Force logo. And then on the right side is their web page where folks can go. And so we're able to do that for each one of the task forces. In the middle is the gained access with the messaging, and then on the right is the intentional. We really want to drive it home that the child's body heats up 3 to 5 times faster than an adult. And we also too want to be able to share that a car heats up 19 degrees in 10 minutes. So those are the two messages they felt were really important to be able to include. Moving on, we have some infographics. Look before you lock, and the gained access with the messaging. Everything was kept between 3 to 5 grade reading level, and to make it colorful and easy to receive the message. So here's the window clings. Maureen showed you the 4x6, but we're also going to make the 11x16. This could be good for childcare centers, retailers, employers who want to be able to put a window cling up and visible when people are coming and going out of their facility. These are parking lot signs. So we had a call from a woman that sits on our Florida task force from Seminole Indian Reservation, and they wanted to be able to do signs. So we first did the palm tree, and that goes along with Florida, but obviously we have the oak tree. So these are two that are going to be available to our task forces. We kept it real simple. If you see a child alone in a car, stop, don't walk away, call 911 and follow directions. And we put the clouds in there intentionally because even on a cloudy day, it can be dangerous. So also too, we have talking points. They can be customized and they're going to be available. Also too, the free children in hot cars. I think this is real important because it's a 10-minute short interactive learning activity that employers can give to their employees to be able to get a snapshot of what the issue is and how they can help prevent it. Also, too, the QR code is the group admin option, which makes it great because we have childcare facilities that require this particular module to be taken each year. So the group admin is able to track their employees to be able to see if they take their courses each year. They also too do this with other modules that we have. There's going to be toolkits. So the members came together and we looked at the toolkits that we needed to incorporate. So we had the advocate, childcare, and hospital together. We have the employer, which Maureen did a great job with being able to show basically what that is going to be. The retailer and corporate, indigenous communities. So those are the ones that we're starting off with. And if we feel that we need to build them out in the future, this just lays the foundation for us to move forward. So all the files that are going to be provided are going to be in a print ready file, digital files for web and email. We're going to have social media graphics. There's a library that we're going to be working with, not only with through the cpsboard.org, but also through traffic safety. That's NHTSA. Customizable templates, everything can be customized, and then you can always print in grayscale because we know that printing on color is costly. So these are where all the web pages are. I put them in the chat so you can be able to look at them. But how this is all situated is that our national resources are going to be all of you as national organizations. Your sites are going to be available. So this is sort of a one-stop shop. When someone is looking for information, all those resources that have been vetted are going to be available to them. State resources come in underneath the safety connection, which is going to be a touchdown page for our state task forces. So I would like to be able to, let's see if I can pull one up. Those that know me, sometimes technology doesn't play in my favor. So let's see. Can everyone see that? This is the coming soon, the Virginia website. They just met this morning, like I said. So you will see that they have their mission, they have their logo, they just did their logo. Join the Virginia Task Force. So that goes directly to a Google Doc that people can apply to be members, and then we provide it back to the chair. It's the law to be able to build that out, and also to the resources. And all the toolkits will be here. And then you have the e-learning module, the national resources, and then we will have pictures of the task force members with "This is my why." Okay. The next meeting that we have is on June 5th, 2025 from 11 to 12. Okay, so I would like to be able to introduce someone to you that I can't thank enough for stepping up and volunteering her time. Patti Liedy, she is the secretary for the state of Florida, and it's been such a pleasure working with her. And she's going to share with you the Florida Task Force and how it progressed. Patti? Patti, I can't hear you. I'm sorry.
Nope, I knew. So when you want to talk about technology, I knew that was going to happen. I even left my cursor there. So guys, I apologize. Let me start again. Hi, my name is Patti Liedy. I'm a child passenger safety technician instructor in Tallahassee. Born, raised Floridian. I wear many hats, much like all of us do in the child passenger safety world. But today I'm here to talk to you about the Florida Vehicular Heat Stroke Task Force and how we have progressed. So here we go. So we are going to go through the acknowledgement, our data, our implementation, the structure, the resources and tools, special projects, the challenges that we've had and how we've had to pivot, and our sustainability. Next slide, please. First of all, I need to make some acknowledgement. National Safety Council, if it wasn't for you, you guys are the backbone of what we do. So thank you so much. Thank you for your support, especially our roadway safety practice division. You guys have been all instrumental in helping us move forward this. Speaking of people who have been instrumental in helping Florida get set up, Jan Null has provided us so much support and data. The Texas Task Force, we can call them anytime we have a question, and we are so thankful for that. Clover for really helping us, get it pushed and ready here in the state, and all of our task force members, national and statewide, because once again, when we do this together, kids benefit, right? And we are all better together for that. So next slide, please. Okay, so to all bring back facts that are back in inactive memory to active memory, talking about heat stroke, pediatric heat stroke deaths in Florida in particular from 1998 to the present. We have 114 deaths. That makes us the second in the nation. That's very humbling. And then Jan broke down the data for us further. By age and circumstances and days of the week and percentage. These can all be found in our meeting minutes, which are on the Florida division of the heat stroke website. Next slide, please. So we started in 2024, and it was decided really early that due to our unique population in Florida, that we weren't just going to focus on pediatrics, but all vulnerable populations such as all children, pets, the unhoused, the elderly, the disabled, and others. And our mission statement is we are raising awareness to those who are vulnerable to vehicle heat stroke, and we're going to advocate for change to the Florida unattended child law to eliminate that allowance for children under 6 to be left unattended in motor vehicles for up to 15 minutes. We all know 15 minutes is a long time, and cars heat up really fast, really quickly. So our structure, we are small, but we are mighty. So our model is we have the NSC leadership. So again, cannot thank Alexis enough. for all the guidance she's giving us. And then Florida is now our model. It is the model to help implement this in states across the nation. We have structured where we have chairs that are currently vacant and the secretary role, and that is me. Next slide, please. So our recruitment and our members, our membership right now is approximately 50. Very excited about that. You have technicians, highway safety professionals, law enforcement, first responders, tribal representatives, people in the private sector, universities and colleges, subject matter experts, a lot of our government agency representatives, Safe Kid coalitions, hospital and healthcare, private citizens, and we are looking for more what would be non-traditional members, such as legislators, lawyers that specialize in injury, elder rights, and animal rights, veterinarians, car dealerships, business owners, and parent advocates. Really, the list for this can be endless. Anyone who wants to join us to help make this change, we would love to have them. Next slide, please. So, membership. I believe firmly that we are cooperative, because if everyone does a little, it adds up to a lot, and we are all better for the children when we work together. So our goal has been to highlight members their local outreach initiatives and recognize and embrace their challenges and give them support. So many of our members of this coalition are already in this field of practice. So we are maximizing on this by having once a month, 1 hour, extremely interactive meetings. So we are finding when we keep the time commitment for a meeting to a minimum, it has maximized our productivity. Next slide, please. Our momentum, we are moving full speed ahead. Our website has launched, and this is our go-to resource. We have, kind of briefly, as Alexis touched on, we have our application, we have our Florida laws, talking about the violation and penalties, and then our Good Samaritan Act and immunities from civil liability. We have all the e-learning resources at the fingertips, the national resources. These co-branded resources are toolkits now, which Alexis has touched on. The supply vendor links really to that innovative concepts display. Our meeting minutes, slideshows, and recordings are all on there. Our calendar of events, and we also have an event registry. Next slide, please. So the pride in these toolkits is they are accessible and adaptable. They are ready for an agency to use, put their logo, print, and they include these customizable emails and parking lot signs, the e-learning course, the printable posters and graphics, and social media libraries, talking points, digital and audio announcements, and temperature display elements. They will be available for printing both in color and in grayscale. Task force member events. So this is to me where it really comes home that we are all better when we work together. These events were already scheduled throughout the state, and we're now just cooperatively sharing our successes. So here in Tallahassee, next slide, please. There was an event at the Capitol where our Rise family joined us and spoke, and it was a demo rescue. The thermometer was there. We were up to 120 degrees very quickly. And, this is just an example of everyone doing a lift. All right, if I could have the next slide, please. Here we have a wonderful event that happened in Pinellas County. And our next slide, was in Palm Beach County. And I know we've all seen these numbers before. It is still extremely humbling for me every single time to sit there and look at that thermometer and see it. Orange County. So Orange County decided they were going to run a social media campaign versus actually doing an event. They ran it on X, on Facebook, and on Instagram. Facebook views were 5,500, Instagram had about 2,000, and X had about 1,400. Next slide, please. So Florida, we're going to be working on some special populations as our projects, as we move ahead. We mentioned we want to help bring awareness to pets and other vulnerable populations. So we'll be working on toolkits and things for that to add. Awareness apparel. One of our great members were like, hey, how can we have something else that like is worn or is visible? We talked about maybe making a t-shirt vector with a slogan on it, and that once again, that brands and companies could be ready to put their own logo on it as well. And then data collection. We all know how data is a lot of the backbone of everything we do and getting grants for everything we do. So social media campaigns, things like that, if we can all collect that data in one central place and share it with each other, we show the impact that we're having everywhere. It can go, nationwide, we can show the impact, we can give it to employers and show the impact. And it really just helps give us numbers to show the reach that we're having. Next slide, please. I think the theme of the year so far has been pivot. And us, nonetheless, we had to pivot too. So we started with subcommittees. As we all know, we all wear so many hats and there's never enough time and there's always so much need. So we found it was hard to add the subcommittee meetings to already busy schedules. And we found productivity highly increased by eliminating the subcommittees altogether. And it resulted in interactive special meetings and a leadership, minimal leadership structure. Next slide, please. So sustainability. How do we move forward knowing that, what we have? So we're going to maintain a regular meeting cadence. We're going to integrate with other existing state initiatives and member events. We're going to keep engaging those cross-sector partnerships, document all of our processes and our best practice, measure that impact and share those results, and then recruit and retain active members. That's wonderful. What I have here in Florida. Thank you so much for having me to present.
Thanks, Patti. Does anyone have any questions for Patti before we move on? Okay. All right, Dr. Reid from Virginia.
Hello, everyone. Can you hear me?
Yep.
Oh, great. Hi, I'm Dr. Becca Reid. I am an educational advocate in the state of Virginia. I have been working with General on data since 2002. And I started with my undergrad studying the case in Manassas in 2002 of a child named Francis Kelly. Followed that case, and it really just drew me in. I have my doctorate in educational leadership, where I wrote my dissertation on pediatric vehicular stroke. So I enjoy what I do, and I just enjoy, really advocating for this. So when I heard about this through the National Safety Council, I was very excited to get this started in the state of Virginia, because why do we want to have a task force in Virginia? Of course, it's 100% preventable. We want to be able to coordinate actions, unite all of our local and state procedures together, identify gaps in policy, practice, and public awareness, create sustainable community grassroots initiative.
Becca?
Yes.
Becca, your microphone is coming in and out, so we're having a little bit of a problem hearing you. Thank you.
Hold on a second. It probably has something to do with technology from earlier today. So let me switch to my phone. Did you hear anything that I said? I apologize.
Yes, but it was just muffly.
I apologize. Let me join through the phone.
It sounds better now, though, now that you're
Really?
closer. Well, it's still a little crackly, but it's
okay. All right, you can go to the next slide. So, like Alexis said, we had met for the first time today with recruitment of members that myself and Sheriff Lenny Mulholland from Frederick County, Virginia, put together. We reached out to some potential stakeholders. We were very excited to see a lot of interest, and we had quite many individuals join us this morning for our first intro meeting to just get this up and running in the state of Virginia. So Sheriff Lenny and I initially sent out the member application with a little letter to potential stakeholders seeking their interest. And we met with quite a few of them again today. We designed our logo, which actually my daughter, she's 21, but she's very good with technology, as I am not. She put this logo together for us, and we're very excited about that. Our webpage is ready to be launched, so we're excited to get that up and running. We are currently looking to identify executive leaders in the state, and we are asking to continue to recruit members. And we are potentially meeting again on May 22nd, so we're very excited to have that, and we've invited Jan Knoll to attend that as well. Next slide.
It's Minnesota side. Do you want me to go back to this one?
I'm good. I'm good.
Okay.
That's
Well,
all from Virginia. Just want to give you an update. We're very excited to get started. So thank you so much for having us.
thank you. Thank you so much for coming. I think what was interesting in this meeting, what the difference was, we had 4 sheriffs there at the meeting today. And that was because of your relationship with Sheriff Lenny. And I think that and him speaking about his situation with PVH, it was horrific back in 1995.
95.
Okay, that's right. Yep. It really has led Becca and Lenny together to be able to do the task force. And I think that working with law enforcement, especially having sheriffs on, it might be a really great thing to ask their PIOs to be able to come aboard the task force to be able to help with social media. So I really think it was a great meeting today, and thank you for inviting me to participate.
Thank you.
Okay, thank you. And we have Lisa. Lisa, are you here?
I'm here.
Awesome. Lisa is from Minnesota.
Hi, friends. My name is Lisa Kons. I am the Traffic Safety and Advocacy Director here in Minnesota. And we have a unique opportunity, being a subagent of the National Safety Council. And then here in Minnesota, we have several different traffic safety organizations that we partner very closely with. So to begin with, I do manage the OPCPS program for all of Minnesota. There is a manager to that program, and there are 4 fabulous liaisons. So that is a natural fit with this project. And when we talk about task force, Minnesota was late to the party on this. And so our task force or our committee is really going to be utilized with work groups we've already got established that already have a mission with this topic as part of their outreach. And so it was a nice fit. We did have an advisory board meeting yesterday, and we had a liaison meeting last week. And so there's already that ball in motion. We're actually putting out programming and then the circling back to really strengthening that task force. But what we're going to be doing is in the state of Minnesota, so we have our CPS liaisons that are spread out lovely through the state who have access to really share this messaging at community events and touches and clinics, etc. We have a partnership with Minnesota Department of Human Services in Minnesota with caregivers. I'm not sure if any of you are familiar with the old CARS training program, but then now we have updated in Minnesota to BEST. That program is in partnership with the Department of Human Services, and it's specific to licensed caregivers and foster parents. And so there's a natural in with that group as well. And then we also have, I mentioned the Towards Zero Death Network. They have 8 coordinators statewide, tip to toe, east to west. So we'll be partnering with them. I manage the Network of Employers for Traffic Safety grant. And so that program is all about getting information into the hands of employers for free. That we have a web page where everything will be posted on the webpage for that. And then we also have Buckle Up MN webpage, which is a brand new website for OPCPS. And we have Kids in Hot Cars page already developed. So we'll be utilizing this information and pushing that information right onto that website. Everything looks fabulous. It's so turnkey and customizable. Why recreate the wheel? I'm an advocate of, let's partner together and get what's already done out there. So thank you for taking the lead and developing, because it's making everything easier here in Minnesota to be able to do. We'll be incorporating messaging and Minnesota is unique. We're not an all year long hot state, but from May until on or around October, we are. So I always compare it to driving. We forget how to drive after the winter months. And just like that, when it comes to this topic, all of a sudden it's really hot out and people forget just how quickly those cars heat up. One other thing that I'm super happy about and eager to partner with is our Indigenous communities. We have 11 of them in Minnesota. I did speak with one of the representatives yesterday. We're going to go over the information that is provided, and we are going to try to work within those work groups too, and at some of the casinos in Minnesota with some of those your car's this hot sign right in front of the casino, because unfortunately those are some of the areas where kids are left in hot cars. So we'll be aligning with the national campaign. We're going to share far and wide. We're going to use our advocates and our traffic safety partners from tip to toe. Our law enforcement liaisons, there's 4 in the state. They go to every chief and every sheriff's meeting. I attend the chief of police conference and the sheriff's conference. So we will be collaborating with those groups as well. They're very excited to get on board. And then at the community events that partner with the different fire departments and the police and the sheriffs, we have what's called Safe Summer Nights in Minnesota, and it goes from the beginning of May all the way through the end of August. This is going to provide really great opportunities for us to get that message out to community as well. I talk faster than I type, and so that was a huge data dump, but we're just super excited that you have included us in on this project, and we are going to do our best in getting the messaging out here in Minnesota. And I just have to say hi, Karma, and thank you for all you do, because where would we be without your partnership?
Yay.
Well, thank you. Thank you for that, Lisa. We appreciate our partnership as well. We are one of the agencies that has a contract to serve as a child passenger safety liaison for the state of Minnesota. And, you know, I think this is a little bit of a dialogue, and I don't want to take too much time on it, but I do want to mention this. I oftentimes think about this topic much like I think about drowning prevention. You know, when you live in California or Texas or Florida and drowning is an issue year round, it's in front of people all the time. It never takes a break. It's always out there in front of people. Whereas with us, drowning is a very seasonal topic for the most part, aside from like bathtubs or, you know, home pools or that kind of thing. A pediatric vehicular heat stroke is for the southern states, it's a year-round thing, right? It's like Lisa said, for us, it's in this part of the country, it's very seasonal. There's both good and bad in that, right? Like we have to be ahead of when that season starts. It's not a year-round. I can see where the southern states where you have to talk about drowning or you have to talk about PVH year-round, you could get kind of sick of the message, and it's always out there, so you get sick of it and your ears turn out to it. So I think we all have our unique challenges of being, I have to talk about it year round, you talk about, or I have to talk about it not year round, you talk about it year round. And we each have the pros and cons to that. But it's just a matter of how do you then, you know, reach out. Right now, we have 14 interviews set up for May 1st, which is National Pediatric Vehicular or Heat Stroke Awareness Day, because it's fresh and new topics. So our radio stations want us, right? So I think there's pros and cons, and just playing on your part of the state and how you make a program like this work, I think is where the creativity comes in.
Thank you, Karma. And Jeanette, you have a question? You have your hand raised?
I do. Okay. Actually, it's kind of a cumulative one. It's not, you know, specific to any state. Is this the right time to ask those?
Yep. Go right ahead.
Okay.
Yep.
All right. The first thing was, do we know, like, maybe what's going on for the NHTSA regional offices? And like connected to that would be any funding coming down? Does anybody have any insight into that information?
That's interesting, because when we met with Virginia, it came to our attention that the Texas State Task Force has some funding going in. So I was going to share with everyone that there's a how-to guide that is on the national on the CPS board website. And what we'll do is that what we've seen today, we're going to build upon. So consider this the foundation and then we're going to keep on building, and we can customize it and we can tweak in order for it to, and Jeanette, I think that's a great thing to focus on, to be able to add into that how-to guide for states to be able to look at where to get funding to be able to support, and we can be able to provide recommendations. So that came up today in the Virginia meeting, and we felt that that would be a good thing for us to investigate and to be able to put those tips in.
You know, I can,
Yeah,
yeah, I can piggyback on that for you. It's grant season. And so I manage 5 grants that are given to me from the Minnesota Office of Traffic Safety that are federal funding grants. And as we all know, that, you know, that we're just in a really weird dichotomy right now. What I have been told is apply for the same amount of funding that I've received. So, and the CPS-OP, or the OPCPS grant, one of our initiatives is this. I wrote it into my grant. And so that is why it is making this a very turnkey partnership, as well as with the Network of Employers for Traffic Safety, because this falls under the driving category. So I highly recommend reaching out to your DOT or your Office of Traffic Safety. Those are the areas that are going to be dealing with federal funding, what's coming, what's not coming. And the asks are now. So work plans will be due, you know, May and June, because they work on that federal cycle. So our grants go through the end of the September, and then they start up again in October. The timing is rich.
Great. Then we should pounce on that and be able to get that document done.
yeah.
So thank you for that.
It could be one of those, not secret, but it could be one of those places to get some funding, which of course would be very helpful. And I don't know if this was already covered, but I did want to make sure that everyone knows New Jersey right now is the only state that has a specific law that the caregivers have to call if a child doesn't show up as expected. And in addition to that, the boroughs of New York City also have that. But those are the only places I know it exists. So if anybody else knows of any, you know, please share. But like the New Jersey one is a good place to go to look for language, because that's just such an you know, essential piece, is if we could get these states to put the laws out there about, you know, simply contacting parents if the babies don't show up as expected. But New Jersey law, good. New York boroughs, good. But that's all I know about, unless somebody else has some information to share.
Jeanette, we met with Amber, Lori, and I, and Amber is sitting on the committee, the Legislative Policy Committee, and working with childcare, and she shared that with us. So we were really excited. She gave us a lot of ideas, and that's how we got to the childcare, the local childcare initiative that the committee will be looking at. So we look forward to working with her to be able to look at New Jersey and also to look at the boroughs in New York. So we appreciated her feedback and her contribution.
Right, and we want the whole task force to know about that.
Yeah, that's great.
The other thing I noticed, which is questionable, is the use of the word intentional. And we know that is such a charged word, and we know how difficult it is for people to even think that it might happen to them. And I thought we had kind of agreed to go with knowingly and unknowingly, because as soon as you put that word intentional in there, it takes people in a different direction. So I would just like to suggest if we could relook at that, and think about not using that word because it is so accusatory and negative.
Okay. I hear that, and we would just need to be able to change our language as how we save the file, because intentional is not in any of the messaging. So we'll change it all in our presentations, but I do hear that, Jeanette, and thank you very much for bringing that up.
Okay, and then you know, yay for all the states that are really getting involved. Great ideas, great programs you got going on. It's, you know, it's fantastic. And I love Minnesota where you brought up the casinos, because that is a very different and specific problem, but it is something hopefully anybody that has casinos in their state can reach out to, because they don't want the liability. We don't want the problem. you know, we don't want the
Mhm.
death, but they usually come to us with open arms.
Mhm.
And we've done some work with their national coalition and have put out some messaging. But that would be a nice place for any state or anyone who's looking to maybe get some immediate pops, because they know it's a problem. And I think they would welcome any help you might be able to give them.
Right. We're meeting with the Seminole and Mississippi tribes. They sit on the Florida task force. And so they actually came to us in a conversation about doing a toolkit to be able to make it national versus statewide. So I'll be meeting with them next week to be able to discuss that. I want to make sure that all the resources are aligned with them, and we'll go forward, but hopefully we'll be able to do it nationally. So Jeanette, if you have any contacts nationally, that'd be great if you could be able to provide support.
Okay. And, really that's it, except for an overuse, and it's okay within this group to say PVH or pediatric vehicular heat stroke. But as we all know, parents don't know what that means. Businesses don't know what that means. And, you see it sprinkled in here much more often than it should be. We have to be calling it what it is and what people recognize it. We know what PVH is, and it's a great little shortcut. So we know what we're talking about, but it doesn't work in the overall population or the consumers.
Mhm.
I would challenge anyone to say a parent's going to go to their computer and they want to know about this topic to search for pediatric vehicular heat stroke. I think that they're going to, look up heat stroke, kids dying in hot cars, and that kind of stuff. So we really want to be careful with our language.
Thank you. If you notice on our logo on the bottom, we did take pediatric out and vehicular heat stroke prevention. So we shortened it. But yes.
Yeah. And it just, for people maybe that haven't been, with it as long as you guys have, is it's just one of those bugaboos that, nice shorthand, but it's not going to work for the people that don't know what we're talking about. So we want to make it as simple as possible. And like, we're trying our darndest to make it a public health issue and not a criminal situation.
We appreciate that very much. Okay, I want to remind everyone that on May 1st, and Karma said it, is National Heat Stroke Prevention Day. NHTSA actually had their playbook out about 3 months ago. I pulled it up and I'm like, oh my goodness. So it's right here. You can hit the QR code to be able to access it. But please do the social media on May 1st and push it out with your folks. Our next meeting for here is going to be July 17th from 2 to 3. I'm taking presentation suggestions. So Jeanette, if you're interested in doing something on childcare, that would be an ideal opportunity to be able to share with the group. Anyone else has presentation suggestions, just send them our way at hotcars@nsc.org. That will come to me, and then we can start organizing the July 17th. But I really hope that this meeting was helpful to be able to bring it all together, to be able to show you where we are right now. As you heard from the state offices, the task forces, they're all a little bit different. And let's put Texas in there, who started in 2015, who has been able to support Florida. So Texas has adopted some of we're doing the web pages, but they're flexible. So everything that you saw today too is flexible. This is all going to be able to meet the needs of all different states, and nothing's written in stone. So these are just suggestions or best practice as we go forward. And I've really been enjoying working with the states because they're all a little bit different. And I love it when things are all a little different, because then you can pull pieces from each one to be able to share with others. So I appreciate all of you. Have a wonderful May 1st, National Heat Stroke Prevention Day. Thank you for all that you do. And if you need to reach me, I'm at hotcars@nsc.org, and it's been a real pleasure. So see you another 3 months. Take care.
Thanks, everybody.